Welcome to Something to Talk About. Thanks a lot for having us along with you. In the corner table at King's Restaurant, of course, we've got the fruit and we've got the chaser platter. But today, and at the end of the show, stay with us. King's has got a new thing. It's a Beyond Burger, completely vegan meat issue thing, meat product sort of thing, but it's not meat. We'll talk about that because we've all on the crew and I have ordered one, and we wanted to tell you what it was about because they got a whole menu that's dedicated to it. I want to introduce to you somebody I've known for a great part of my life. Her name is Patti Rivera Castro. She has been a champion of all things to relieve and to assist and advocate for people with cancer. And that role has led her into other roles, and I'm so glad to be able to take some time during the Christmas season to focus on people who try to do good for the island. Thank you, my friend. Good morning.
Well, good morning, Patti. Thank you. I'm very honored and humbled to be here. I appreciate this opportunity to be able to talk about some of the organizations I volunteer for.
Yeah.
So as I was sharing with you earlier, this is really not about me, but about calling attention to the organizations and services that are available to our people here, so that hopefully they are aware of what they can access and reach out to, so it can help them on their journey to a healthier life.
Let's first of all start sort of at a beginning point. I will drop that Kathy and I have known each other for a long time because we were classmates who graduated together in 1977. Do you want me to say that? Okay.
Yes,
I wasn't sure if you were okay with that, but 1977 from the Academy. So we've known each other for a lot of years. The last job that I remember you having is that my job mixed in with your job where you were doing marketing and public relations at a time, and so we got to see each other quite a bit. When did you change from that into becoming this champion?
Well, when I was working at that job, I unfortunately suffered a motor vehicle accident that put me unable to work anymore. And so for many years, recovery took a long time for me, several years, and then so I just didn't work anymore. And then several years back, my youngest son got diagnosed with cancer, and we had to take him off island for care. And when we did that, I realized we were under the medically indigent program insurance with public health, and we were sent off island because care was not available here. And as we were in California at Good Samaritan Hospital, the challenges of being away from your support system, away from your home, was really difficult. And I also knew that there was a lot of obstacles in the system. We were there, and sometimes my son needed to get prior authorizations and things like that, and it was really challenging because we needed to communicate with public health. And with the time difference, that was hard. But what I told my son at the time was that you needed to fight this disease. I can't do that for you, but I promise you from this day forward, I will fight anything and anyone to get you what you need to stay alive. So I became his voice, I became his advocate. And really, when someone is fighting a disease, a condition, they need to concentrate on their health. They shouldn't have to fight the system just to be able to get what they need. And
can I ask you, unless it's too personal or intrusive, what kind of cancer?
Andre was diagnosed with a bone cancer in the spine. So, and our challenges took us back and forth from Guam to the mainland. Andre currently resides in California where he continues his cancer journey, but I remain on Guam, and as I said, the challenges that we faced became very apparent to me that it was not unique. Everyone else that had to go off island or had to access the system, whether it was public assistance or private insurance, had the same challenges we had. And so I chose to honor my son by being a voice for those on our community, and that's kind of where it all started.
You were dealing with a lot of documentation, you were dealing with paperwork, and there was we're talking, what year was that?
It was back in 2008.
How sophisticated was the referral system?
it's come a long way.
Yeah.
It's come a long way since then. But what it is that back then, of course, the referrals of island were very new because at that time we only had one cancer doctor on the island. We weren't doing radiation treatment.
Right.
So there was quite a few issues concerning, and I also knew that public health, if you were under the medically indigent program or the Medicaid program, I know that they had contractual arrangements with specific hospitals, so you couldn't just go anywhere. And I do believe that the private insurance also had contractual arrangements. So there was these issues of the care a specific patient needed was not available at those hospitals, so it was a matter of navigating the system to try to get into the hospital or facility that you needed. Navigating the system and trying to ensure that payment is made on a timely manner so that you're able to access care. And being off island and like I said, with the time difference, having to call public health, saying, doctor ordered this procedure, you need a prior authorization. One of the first things I did when I came back was, look, if you're gonna send someone off island, give them a blanket authorization. No doctor in the mainland is gonna order unnecessary tests. They don't have time for that. They have other patients. And it was just a matter of letting our people on island, our policymakers, our government leaders, realize where some of the obstacles were, some of the issues, and I had a mouth, so I opened it.
Yeah, well,
I had a mouth.
Yeah,
yeah.
You couldn't have picked a better advocate.
So,
you're only as effective as the ability to work around a system that now is antiquated for sure.
Right.
But at the time, it wasn't efficient and it didn't do anything. You mean you had to triple back sometimes to be able to do the work.
And when you're in California and you're calling public health, that's a long distance call.
Yeah.
And you have financial constraints. So, some of the things I had to tell them is like, look, and why if a patient travels, let's say the patient is elderly and it's the husband, they're both elderly, they wouldn't know who to call, how to ask the question, or if the families cannot afford to accompany a patient, the patient's sitting in a hospital bed having to call for assistance, referral, answering a question. Yes, there was a medical referral office there, but nonetheless, it was there at Good Samaritan, which was great because it was accessible. But what happened if you went to Cedars-Sinai? What happened if you went elsewhere? So those were concerns, and I was very grateful back then. It was Governor Eddie Calvo that when I first came back, I asked him, I said, can we talk about this? And he heard some of my concerns, and he actually navigated me and connected me to his health policy people and says, talk to her. And they took into consideration some of the things I brought up, and they did what they could to address the issues. Yeah. And it's, like I said, we've come a long way. So I think they're realizing some of the challenges, which, I don't know, maybe they didn't know about it. Yeah. They weren't aware.
Well, they wouldn't have known about it. They would not. Maybe some families who went to seek some treatment after they got home were just grateful to be back here and changing the system.
And some of the other things I found out very quickly on was that a lot of people were afraid to even question. A lot of people were afraid
because they afraid that they would lose their benefits?
They would lose their benefits, or that you don't question who's giving you, just be grateful.
Yeah.
But, from my point of view is if there is a concern and you're aware of it, maybe they're not. Let them know. Let them know. And that's where I came from.
So how, this obviously, this translated into something bigger. It went from you caring, and being motivated to care for your son. How much bigger did it get after that?
Much bigger, because I got involved in the Guam Cancer Coalition, which led me to the Non-Communicable Disease Consortium, which branched out into the Tobacco Control Coalition and the Diabetes Coalition. And then I also got involved in the Pacific Association of Radiation Survivors. And at one point in time, I was asked to serve on Agent Orange Task Force. But basically, it translated into getting access to care and ensuring that we do what we can to improve the quality of life of our people. One of the things I always tell our policymakers is that if we can just ensure that our people get access to health care, access to early screening and detection. Ultimately, it's going to help our economy because we're keeping people healthy. You know, you won't see the benefits immediately, but you see it in the long run.
Yeah. Well, I think we want to talk about that, what the long run is. Like you said, that you graduated from that into now doing a lot of other things.
Yeah.
And you started off being an advocate for your son, but now you're an advocate for thousands, and that has led you some great places. We're talking to Patti Rivera Castro. We're going to take a break and come right back with the rest of our conversation at the end. This is Beyond Burger, which is being served at King's. It says drippy as a regular burger. There's no question about it. They have an entire menu that's dedicated to the product, Beyond Burger, which is like a, vegetarian, and they could make it vegan if you wanted it. But this has got Swiss cheese on it and all the other stuff that you like gluten-free. And I wanted to try it because it's something new and an alternative. So she doesn't want to eat this because she's got a lunch to go to. But Reese and I want to eat this. Okay, we're good. We're good.
Go for it.
You know what it has? It has that same smoky grill taste that they do with the regular King's Burger. Oh my God. Look at that. You couldn't even tell that it wasn't.
It's humongous.
You can't tell that it's not like it's really good. It's really good.
I'm gonna have to come back and try that.
Yeah, you'll have to come back and try this. You're gonna have to come and order this. It comes with everything. We have mayo. I have mayo and Tabasco and ketchup. It comes with fries or it comes with coleslaw. However you want to do it. It is the Beyond Burger. Come and get one over at King's. All right, see you guys later. Well done. Well done. Welcome back to Something to Talk About. I'm here with my dear friend, Patti Rivera Castro, who has, I think, impressed me, Patti, all of the years that I have known you.
Thank you.
We've always been friends, sisters, as
definitely.
girls do when they graduate from high school and they know each other from childhood. It was when your son, Andre, was sick, you stopped at nothing. That was the thing.
Yeah.
That was really admirable, because I didn't know very many people who had gone through the system the way you had and coming out of these problems with the bureaucracy.
Well,
and your story
it's called
was
a mother's love.
well. So
That's
I don't know
definitely
any
what it
mother
is.
would
Yeah.
not.
Yeah,
I don't know
absolutely.
any mother. One of our mutual friends, Melinda Sanchez. She's Lou and Simon Sanchez's daughter. You're
Right,
familiar
yes,
with
yes.
her son as well. I don't think
And she's doing the same thing.
She is. She's
Absolutely.
advocating, and she's doing it, which is interesting, is that she's doing it in 2019, where the mass technology, or the technology to reach the masses, are there, and her mother's doing it, and Simon's doing it, and all her family members. So they've got fingers in all those social
Absolutely.
media platforms. I just have to ask you that the money was tight. I'm pretty sure it was tighter
absolutely.
then than it is now, because you didn't have as much outreach. Yeah.
And it was, and but you make do. And one of the things of why two reasons why I do what I do is, number one, you mentioned about how I went from advocating for one person to thousands, but ultimately I'm often asked, about my credentials, and I said, my credentials, I'm a mom and a grandma. That's my credentials. And I want to see my children and my grandchildren, especially my grandchildren, who are just growing up in this community, grow up in a healthier environment. And I don't want to see any other family have to go through what we went through. And if there's something that we can do through I can do through education, through policy change, to make that happen, so be it. But my grandchildren's generation and the generations after them, we have a moral responsibility to make it a better community for them. And then the other thing is, when the beginning of Andre's journey, yes, times were hard. Financially, physically, emotionally, it was difficult, but people came out from everywhere to assist us. And for me, this was my way of giving back. And I've always said that my time, my talents, and my treasures come from my Lord. And all he ever asks of me is to give it back to his people, and I'm hoping that's what I'm doing.
How is Andre now?
Andre's doing well. He's managing. He's happy. Andre got married to
Yeah.
his, as you know, he got married to his middle school sweetheart, and she has her own health challenges, and they were soulmates because they understand one another's physical hardships when the time comes. But the point is, he's living his life, and I never would have thought in the beginning he'd ever get there.
Wow.
But he's living his life. He's living it as an adult, and he's living it, and he's happy.
So
what more can a mother ask
Well,
for?
this is true. And so on to the next thing.
Yeah.
I met Kathy because she was in a conference today. I don't know if you can call it a conference, but okay. And I was like, okay, so what are you doing? And we weren't just talking about cancer. We were talking about tobacco use. We're talking about diabetes. We're talking about different non-communicable diseases that require structure and planning for the future. And so you went from just solely, this one disease to branching out in other diseases that affect Guam specifically.
Well, the top 4 causes of morbidity on Guam, number 1 is cardiovascular heart disease. Number 2 is cancer. Number 3 is cerebral, so strokes, and number 4 is diabetes, and they're all intertwined and connected. And so I went from and the Non-Communicable Disease Consortium, which I am a member of, covers that. And so it went from, like I said, being a cancer advocate just to being a community advocate for all of that.
Yeah.
Because really, when you fight for one disease, fighting for the others is about the same thing.
Right.
You fight for the same reason, just change the disease.
Yeah.
But our people are suffering. This NCD consortium, Non-Communicable Disease Consortium, was created many, many years ago because Jim Gillen, as the Director of Public Health, went to this regional conference, and they were looking at the high rates of NCDs in our region, and he comes back to Guam and takes a look at our rate and goes, we need to do something. So the consortium was born. And so, we have community partners, stakeholders, government agencies, everybody coming together to try to address lowering those rates and those incidents.
Some of it, I'm pretty sure that I don't have to tell you this, that sometimes when you're doing this kind of advocacy work, you run into situations that become political.
Yes.
And so there have been instances where, we've had pieces of legislation that people have fought for and took some time to get there, and you were on the sidelines. Natasha Protection Act was one of them, and that there have been amendments to that law.
Definitely.
To now encompass larger, areas where we didn't know from the very beginning. We just thought it was secondhand smoke.
Right.
And then it became something much bigger.
Much bigger.
That part of it, was that fun, sort of getting in the politics a little bit?
It was fun, but one of the benefits of our community, one of the privileges, I call it a privilege, is the fact that we live in a really small community. We have the privilege of having direct access to our policymakers. So you can actually tell your story to them. You can actually find out. And I remember specifically when we were pushing the Tobacco 21, raising the minimum legal age. One of the strategies that we did was we wanted to meet with all 15 one-on-one. And we concentrated on the ones that didn't support it. Why? Because we wanted to find out, well, what about this law or this bill that you don't support? Why are you against it? And then what we did was we found out from them, took that issue, went back, addressed it, and that was how we were able to get it passed
But
unanimously.
you weren't hearing from bar owners saying, I'm going to lose a certain amount of percentage of business?
Interestingly enough, we heard it from bar owners, but when you took a look at the percentage, it was like maybe 3% saying it's going to hurt my business. The majority of them were saying...
Because you could still walk outside and smoke. Or you would have to invest in it, right?
In an air, specifically an air curtain that was accepted, and approved. Yeah. And many of them were saying, no, it's not going to hurt my business. And when it was passed, there were really no negativity that came out of it.
And I think that part of that was also because they had employees there that didn't smoke.
Right.
They had
And
owners
that was the position we came, was that it's not just about your customers, it's about the health and safety of your employees also.
So what's next for you? I mean, is there a next, or is this, you're going to keep on, fighting these diseases?
Well, you know, it's a never-ending battle.
Yeah.
So what's next is we just move on. We continue to move on, trying to ensure that we talk to our policymakers in continuing to fund some of the programs that we do for education and awareness, continuing to tweak our laws to cover issues that we didn't address before. And, you know, it's a learning process, like the Natasha Protection Act. You know, and we have the issues of the ENDS device, or electronic nicotine delivery system. The community knows it as vaping, but it's technically not vaping because these electronic devices emit an aerosol, not a vapor. So it's a matter of looking into policies that can regulate that, because we talk about secondhand smoke and third-hand smoke. Well, there's such thing as secondhand and vaping and third-hand vape, and you know, it's a matter of educating our community on the dangers and the harms of it to keep our communities.
Well, I got to
healthy.
tell you that I'm so happy to see the work that you've done and staying true to your commitment to give back to the community.
Yeah.
We follow you all the time. I know you feel like it's not about you, but it is about you.
Yeah, and like I said, it's not just me. I work with a group of lots of individuals that are just as committed, you know, just as committed. And our, like I said, our policymakers and our government leaders have never shut the door on us when we come calling.
Well, that's
I'm grateful to that.
another face that you say no to.
Yeah.
That's for sure. Watch out, she could come into a hallway near you. Thank
Yep.
you, my friend.
Thank you. Merry Christmas,
Merry
everyone.
Christmas, everyone. We'll see you next time on Something to Talk About.